So I'm going to kind of whip through this part. In terms of CAT referral motivation, there are many motivators in terms of a referral coming for catastrophic impairment determination. Some are more obvious than others. I know that Rocco probably covered some of the areas yesterday. The first and most obvious is that it just is apparent that the claimant or patient in front of a GP or specialist case manager anticipates that the individual will meet one of the CAT criteria, at least one of the CAT criteria. However, increasingly, especially since the changes in the SABS regulations as of September 2010, some of the other criteria are becoming increasingly utilized, even if it's not certain or not as clear that the individual will meet one of the CAT criteria. So I'm speaking, of course, of the reduction of the SABS entitlement benefit for medical and rehab purposes having been reduced from $100,000 to $50,000. So obviously, if an individual is now likely to hit that cap of $50,000 without any further recourse outside of tort-based awards or settlement, we're seeing an increase of folks applying for CAT, even though it's not likely they're going to be CAT, but just because it's the only kind of potential option for them to be able to continue their benefits. Okay. Similarly, from the standpoint of attendant care, given that has been dramatically reduced, same principle applies. Sometimes we have individuals that have very complex needs, but they might fall short of CAT otherwise. And the need really is to coordinate a multitude of services. So we know that catastrophic impairment entitlement also allows the individual, as an added entitlement, access to automatic case management services. So sometimes that really is the sole motivator behind a CAT application. Further, there are situations, the most common ones tend to lie in the orthopedic realm, whereby we oftentimes will hear orthopedic specialists comment that this individual is stable for now, but after a 10 to 15-year time horizon, maybe longer, it's anticipated that through an arthritic process or other types of related deterioration, that there might be a significant need for a joint replacement, certain type of surgery, or the like. So that again, we know that with the regular entitlement, the individual claimant has access to 10 years worth of services of all sorts. Then everything shuts down in the claim. However, with catastrophic impairment entitlement, those entitlements are lifelong. Okay? Tends to be even more relevant to the pediatric population. Basically, the younger that you are, and the more that your condition may potentially deteriorate in the future, the more likely a CAT designation is going to be highly relevant to that individual. And the final aspect of catastrophic determination motivation is that of legal case building. So that even if a lawyer is uncertain that a case is going to, or really doesn't feel likely that the case is going to result in a CAT impairment entitlement, what's the beauty of this process is that you pretty well automatically are guaranteed a clear set of reports that will indicate, that will meet the threshold being the permanent and serious impairment. By definition, if you have a guides-based rating, even if it's 10%, 15%, whatever it is, we cannot make that rating unless the impairment is a permanent one. Okay? There's some exceptions to that I'll speak to, but in general, that tends to be the principle. So they can still do a lot with a 25, 30, 35% whole person entitlement. It kind of really assures a foot in the door from the standpoint of tort. Of course, that's probably the least legitimate of all, because it's not trying to access something from the AB perspective, the SABS perspective. But certainly in terms of what's happening out there, and if you're questioning why a lawyer might want you to still pursue it, even though it seems like it's going to be a case that's going to fall well shy of tort, that's likely the motivation behind it.